is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. We're back today with a great topic. It's premenstrual syndrome, which is also known as PMS. And most of us are affected, not all women, but most of us are. And if you've never subscribed to our channel, please go ahead and do so. We love your feedback, and always hit that notification bell so you know when we've uploaded our next video. And as you always do, we appreciate it. Give this video a thumbs up. Today is about PMS. Like, what are some of the symptoms that you see me have when I have PMS?
Usually pretty irritable.
Irritable.
Mostly. Energy level doesn't seem to be as high.
He's right. So a lot of us, it usually happens 2 weeks before a menstrual period starts, and you can get a variety of emotional symptoms: irritability, feelings of worthlessness, sadness, crying, anger, mood swings, and also physical symptoms like back pain, changes with your bowels, diarrhea, constipation. You can also have lower abdominal pain, breast tenderness, even headaches. And a lot of us suffer, and we have 4 ways that you can help yourself and your partner so that they don't have to suffer during the PMS times. Typically during PMS, these symptoms will start about 2 weeks, 10 to 14 days before your period starts, and then immediately when your period, you see the blood, your symptoms, majority of them go away. And there's a more severe type of PMS called Pmdd, which is premenstrual dysphoric disorder, and that happens like where the PMS symptoms are so bad, now it's affecting your work relationships, your life relationships, and those have to occur about the 10 to 14 days before each period for at least 6 months, and that's how we make the diagnosis of Pmdd. For basic PMS, and we'll cover Pmdd in a little bit, we can do 4 things that help us. Number 1, lifestyle. You want to incorporate exercise at least 30 minutes 3 times a week. And it can just be even basically walking, but any kind of exercise 3 times a week, 30 minutes at a time, will help alleviate some of the symptoms. Another one is using mind-body techniques. So incorporating, we all know scientifically wise that emotions and feelings do affect our physical bodies. So incorporating yoga and massage, and also qigong, as well as reflexology, do help. There's other things like if you want to get into group therapies, cognitive behavioral therapies, that's great too. That all helps as well as guided imagery. The second thing that can help, nutrition. You want to eat a diet that's low in fat, high in fiber, and limit your intake of alcohol, salt, caffeine, and refined sugar products. The third thing that we can do to help ourselves is to take supplements. Calcium is one of them. You want to take between 500 to 600 milligrams every day. Another one is vitamin B6, 50 milligrams every day. And the third one is magnesium, 200 to 600 milligrams every day. The fourth area that's going to help us with our PMS is the botanicals. So these are herbal supplements that work as medicines. One of the ones that work for both PMS and the more severe form called Pmdd is called chasteberry. The scientific name is Vitex. You want to take these doses. It's 250 milligrams to 1,000 milligrams of the crude herb, or 20 to 40 milligrams a day of the standardized extract. Now, if you've noticed, or your partners or your family or your workplace has noticed that you have the more severe PMS symptoms where you're raging or you are so sad you can't handle yourself, these are most likely Pmdd symptoms, premenstrual dysphoric disorder symptoms. These have to happen within the last 6 months, about 10 to 14 days before each cycle, and these are affecting now your life relationships. You might want to investigate another botanical called St. John's wort, and the dose is 300 to 600 milligrams of the standardized extract taken 3 times a day. Now, if you're still not having any improvement with your Pmdd, which is a more severe form of PMS, with lifestyle modifications and approaches with nutrition and mind body, as well as exercise and botanicals and supplements, then you may want to consider pharmaceuticals. So we do have low doses of SSRIs. SSRIs are serotonin reuptake inhibitors. Those are things like fluoxetine at a dose of 10 to 20 milligrams every day. And I know fluoxetine, what I do for our patients is they can take it every single day of the month. And a brand name of it is called Serafem, but the generic is fluoxetine. And I usually start my patients at a 20 milligram dose because the 10, they just didn't feel much of an effect. And you can either take that every single day of the month, or you can do it the 2 weeks prior to each period. I just think it's easier to take it every single day of the month. The other thing that you can do is sertraline at 50 to 75 milligrams a day, paroxetine 10 to 20 milligrams a day, and finally citalopram at 10 to 20 milligrams a day. Another pharmaceutical that you might want to try is progesterone. Progesterone deficiency before the period onset can cause some of our PMS symptoms of breast tenderness, moodiness, hair loss, weight gain, bloating, and it really does help, as well as migraine headaches. Progesterone can be compounded progesterone as well as pharmaceutical, what are those called when they're already in the drug companies? They're not compounded, they're prescription progesterone. Those are things like prometrium. Prometrium is a micronized progesterone, and you would do a dose of between 100 to 200 milligrams at night, about 12 days prior to the onset of the period. So you would start it on the 11th day of your menstrual cycle. So that would be starting on the 11th day after the first day of your period, and you would just take one capsule every single night. Same with the compounded progesterone cream. You want to start at a low dose of like 10 milligrams or 20 milligrams applied to your inner thigh. And so you apply that every night on the days 11 to 23 of your menstrual cycle. The other, was that right? 11 to 23. Yeah, so that's 14 days out of the cycle. Lastly, birth control pills. Oral contraceptive pills that are combination birth control pills can help PMS as well. So hopefully this helped you guys with relieving some of the PMS symptoms, because none of us like to feel like we do whenever we're upset for, not a really rational reason, or we have breast tenderness, bloating, we've got a lot of food cravings. And I remember even if I avoided a lot of candy and exercised more the 10 days before my period, all of a sudden my period would come and be like, oh, I didn't have PMS, my breasts weren't as tender, I wasn't as moody. So it does work. Our next midweek check-in, which is coming up, is
Sammy.
Sammy's used in his clinic a lot, and it's really good for his pain patients. So that'll give you a hint what it's for.
Well, that's all for today. Thank you all for joining us, and you guys have a fantastic Sunday. Bye-bye. You just kept going, didn't you? You were like taking it, making it your own. Make it
Lay down, I'll lay down with you.
Oh.
Are you okay?
I'm kidding. I was joking.